Gentlemen, let me ask you something that I hear almost every single week in my office. Do you go to bed determined to finally get a full, deep, restorative night of sleep, only to find yourself wide awake at 2 a.m. on the dot, standing in the bathroom, half asleep, frustrated, and already worrying about how exhausted you'll feel tomorrow? It's a maddening ritual. You didn't drink that much water, you didn't do anything reckless, and yet there you are again. Most men sigh, shake their head, and say, well, I guess this is just what getting older feels like. Others start blaming themselves. They cut water, they stop hydrating, they suffer through dry mouth and cramps and still wake up at 2 a.m. But here's the truth I want you to hear right now. Your bladder is not the problem. Water is not the enemy. Your bladder is just the messenger. The real reason you're waking up at 2 a.m. has far more to do with gravity, temperature, hormones, and timing things your body was designed to handle when you work with it, and that backfire when you don't. Tonight, I'm going to walk you through the 5 most overlooked mistakes that cause middle-of-the-night bathroom trips in men over 50, and more importantly, how to fix them without medication, without shame, and without dehydrating yourself. We'll count them down from number 5 to number 1. And mistake number 1, the one almost no man ever hears about, can cut nighttime wake-ups in half starting tonight. Before we dive in, do me a quick favor. Hit the like button so more men can find this information. Subscribe so we can keep working on your health together. And in the comments, tell me, where are you watching from? I love seeing how far this community of men committed to better health truly reaches. Let's clear something up right away. Waking up at 2 a.m. to urinate is not a normal, unavoidable part of aging. It's common, yes, but common does not mean inevitable. What's really happening is that after 50, your body becomes less forgiving of small timing mistakes, posture habits, and environmental signals. The systems that once quietly compensated now need a little guidance. And the good news? These systems are highly trainable. My name is Dr. Jocelyn. For the past 5 years, I've worked closely with men dealing with sleep disruption, urinary changes, energy loss, and the quiet frustration that comes with feeling like your body is no longer cooperating. And I want to tell you something reassuring. Most of the men who fix their nighttime wake-ups do not need pills. They need understanding. When you understand why your body is waking you up, the solution becomes logical, not stressful. Let's pause here, because this matters. Fragmented sleep doesn't just make you tired, biologically. Testosterone production drops, blood sugar control worsens, inflammation rises, blood vessels stiffen. Emotionally, mood becomes fragile, patience shrinks, confidence quietly erodes. Practically, energy disappears by mid-afternoon, focus drops, motivation fades. So fixing this isn't about comfort alone. It's about protecting your vitality, dignity, and independence. Now let's break down the 5 mistakes, starting with the most common one. Mistake number 5, the one last drink myth. Most men think they're being responsible. I don't drink a lot before bed. It was just a small glass of water. It was herbal tea that's healthy, right? Here's the truth. The rule isn't drink less at night. The rule is stop drinking earlier than you think. The biology. When you drink fluids, they don't magically go straight to your bladder. They enter your bloodstream, increase blood volume, signal your kidneys to filter, become urine. That entire process can take up to 3 hours. So, a glass of water at 9 p.m. when you go to bed at 10:30 often peaks in urine production right around, you guessed it, 1:30 to 2 a.m. Your body does have a defense system, a hormone called ADH, antidiuretic hormone, which tells your kidneys to slow urine production at night. But drinking too close to bedtime suppresses ADH, keeping your kidneys in daytime mode. The fix: front-load hydration earlier in the day, set a hard cutoff for significant liquids at least 3 hours before bed. A study in the Journal of Clinical Urology showed men who followed a strict 3-hour cutoff reduced nighttime urination by up to 40%. Be honest, what time do you usually stop drinking liquids? Drop it in the comments. Mistake number 4, the hidden diuretic dinner. You managed your fluids perfectly, and you still woke up. This is where food enters the picture. Part A, late, heavy meals. Eating a large meal within 3 hours of bed keeps your body in digestive mode. Digestion pulls blood toward the gut and produces metabolic water, adding extra fluid to your bloodstream. Your kidneys then have no choice but to process it often at night. Part B, healthy diuretics. Some foods naturally increase urine production or irritate the bladder. Celery, asparagus, cucumbers, bell peppers, spicy foods, alcohol, even small amounts. That late night healthy salad, it may be the real reason you're waking up. The fix. Finish your last substantial meal 3 to 4 hours before bed. Move diuretic foods to lunch. For dinner, favor cooked vegetables like carrots, broccoli, or sweet potatoes. Mistake number 3, the rushed bathroom trip. This one is simple and powerful. Most men use the bathroom before bed, but they rush. The biology. Your bladder is a muscular pouch. When you rush, you often empty only 80 to 90%. That leftover urine gives your bladder a head start on refilling. The fix. Double voiding. Make this your final bedtime ritual. Sit down. This relaxes the pelvic floor. Urinate normally, no straining. Wait 30 to 60 seconds. Lean slightly forward. Rest your elbows on your knees. Try again. That second release is often small, but it can buy you an extra hour of uninterrupted sleep. Mistake number 2, your bedroom's microclimate. Your kidneys respond to temperature more than most men realize. Too hot, body can't cool properly, deep sleep is disrupted. ADH doesn't rise fully, even mild bladder signals wake you. Too cold. Cold triggers cold diuresis. Blood vessels in hands and feet constrict, blood shifts to your core, kidneys sense pressure and increase urine production. This is why you always feel the urge to urinate after swimming in cold water. The fix. Keep your bedroom cool, not cold, wear breathable fabrics, use light, adjustable bedding instead of heavy pajamas. Mistake number 1, gravity, the one no one talks about. This is the big one, and once you understand it, everything clicks. The biology. All day long, gravity pulls fluid into your lower legs and feet. By bedtime, that fluid is sitting quietly in your tissues. When you lie down, gravity releases that fluid back into your bloodstream, blood volume rises, kidneys detect the increase, urine production ramps up at night. Your bladder didn't cause this, gravity did. The fix. Outsmart gravity. Elevate your legs for 60 to 120 minutes before bed, feet higher than your heart. Let your kidneys process that fluid before sleep. A study in the Journal of the American Geriatric Society showed leg elevation significantly reduced nighttime urination. Bonus tip, sleep on your side, especially your left side, to reduce bladder pressure and improve circulation. I know what you might be thinking. Dr. Jocelyn, that's a lot. I hear you. So here's the rule I give every patient, the rule of 1. Don't fix all 5 things at once. Pick the one mistake that made you say, "Ah, that's me." Master it for the next 3 nights. Small, consistent wins create lasting change. Gentlemen, this matters. You are not weak. You are not broken. You are not just getting old. Your body is responding exactly as it was designed to. It just needs better signals. When you work with your biology instead of fighting it, comfort returns. Confidence follows. Sleep deepens. Dry, uninterrupted sleep is not a luxury. It's a foundation. And tonight, you can start reclaiming it. Tell me in the comments, which mistake was your aha moment? If this gave you a plan you can actually use, type plan in the comments. Subscribe so we can continue this journey together. I'm Dr. Jocelyn. Sleep deeply. Gentlemen, your body knows how, once you let it.